Since 1999, Syracuse Orthopedic Specialists has been the trusted provider for total orthopedic care in central New York. Its locally owned one-day surgery center provides operations that, with the help of new technologies and more efficient procedures, allow patients a quicker recovery from the comfort of their own home. Now, by partnering with this center, St. Joseph's Health offers its patients a safer, more convenient option for same-day joint surgery. Here with us to discuss this partnership is Dr. Max Greinke, an orthopedic surgeon from Syracuse Orthopedic Specialist. This is St. Joseph's Health Medcast, a podcast from St. Joseph's Health. My name is Prakash Chandran. So, Dr. Greinke, thanks so much for joining us today. I really appreciate your time. I wanted to get started by asking, what exactly should people consider joint replacement?
Right. That's a great question. Joint replacements for most of the time is for severe arthritis of the knee and the hip. And the great thing about what I do is that, you never need a joint replacement, right? But if you've got bad arthritis and you've failed all the conservative treatment and your joint pain is either preventing you from doing the things that you want to do, the things that you need to do, or making them miserable, that's really the time to start thinking about doing a joint replacement, assuming that you've tried everything else.
Yeah, and I think that's why they generally refer to it as a quality of life operation, because if it's impeding on the quality of your life, then you should consider getting it and removing that pain, right?
Absolutely. Absolutely.
Now, is there a certain demographic that you see more for joint replacement than others?
Well, that's one of the other great things that I like about the specialty that I do, is that it's just people who generally are later in life. But for me, I don't really have an age cutoff. It's more, do you have the x-rays that show that you've got bad arthritis? Have you tried everything else conservative? And then is it affecting your quality of life? And if all the answers of that are yes, then in my mind, it's okay to consider it, whether you're young or you're old, as long as you can medically get through the operation.
Okay. Now, one of the things that I do want to talk about today is that one-day or same-day surgery center. But before I do, I'd love to just understand traditionally, what is the typical recovery time when someone goes and gets a joint replacement?
Right. Hips are totally different than knees. And so for my knee replacement patients, I always tell them the first 6 weeks, they may not like me that much, but after that, they'll start feeling better about life. But for example, if somebody does desk work for a living, then they're going to be out of work for probably 4 to 6 weeks. And if you do construction work or something that's really labor intensive, it's going to be more along 2 to 3 months that you're going to be out of work for. But generally by the 6-week mark, people are pretty happy they did the operation.
And in terms of recovery time and getting the patient home, how long does that traditionally take?
Yeah, traditionally, and this has changed a lot in the last 5 to 10 years, I would say. But now even my hospital patients are generally a 23-hour stay, so coming in the day before surgery, one night in the hospital, and then going home the next day. Traditionally, people were in the hospital for 2-3 days, and actually it used to be that the Medicare made you stay in the hospital for 3 days. But that's definitely, it's the way that things were going, and then the pandemic sort of accelerated that exponentially, I would say.
Yeah, that makes a lot of sense. So let's talk a little bit about the one-day surgery center that you're a part of. Talk to us about what it is and some of the recovery times that you see there.
Right. And so St. Joe's is now our partner here too. And it's basically a surgery center, but we always joke that it's a mini orthopedic hospital. I'm sitting here right now. Today I did 8 joint replacements here. And I always tell patients that if you're healthy enough to come here and they're comfortable with it, it's a nicer experience in the sense that everything here is streamlined, geared towards joint replacement. So from the minute you hit the door, there's a team working on you. We get you in and the surgery done. And then as soon as the anesthesia is worn off, we get you up and moving, get you on your road to recovery, most of the time home or on your way home within 6 and 7 hours after hitting the door.
That is pretty incredible. You said that traditionally people had spent 24 hours to a couple days waiting until they're discharged. And now in the surgery center, you're basically cutting that time down by a fourth. And people can recover where they feel most comfortable. And that's at home, right?
Right, exactly. So I tell them if it's safe for you to go home and you're going to be recovering from operation, you might as well be in your own bed with your own food and with your own family.
And what about the ongoing, help or treatment? Is there some sort of outpatient physical therapy that patients are provided?
Yeah, absolutely. Like I said, knee replacements, it's absolutely critical to the recovery. And so we have, as part of the surgery center, it's not just we see in the office and you show up. There's a whole lot of work that goes in to make sure you're optimized for surgery. You know what you're getting into, that you know what we expect of you, know what to do afterwards. And so before the operation, generally we have you see your physical therapist once just to get you ready for the recovery. And then we're generally having you see them within 1 or 2 days after the operation to get started on the recovery.
So it really sounds like this one-day surgery center and this partnership with St. Joe's has been an incredible boon for the community. I was wondering if you could share a little bit around how it actually got started.
Right. St. Joe's has been our partner for a long time. It just before it was exclusively at the hospital. And they've been extremely good to us. And I even still joke that the surgery center is probably all of our favorite place to operate, but St. Joe's is pretty darn close. And we've been partners in taking care of joint replacement patients for a long time. And now moving forward, we're happy to have them on our team here. Just I think what they bring to the table is making sure that we have all the resources we need, especially given the post-pandemic stuff with supply chains and manpower and high-level planning and things like that.
So can you tell us a little bit more about what the process of getting a joint replacement looks like? Like if someone is listening to this and they're thinking about it, can they just walk into the center and get seen by someone? Do they need to schedule an appointment? And are there a series of assessments that take place? Walk us through that.
Yeah, absolutely. So anybody who has arthritis in their hip or their knee, we'd be happy to see in the office. And it's the good thing about SOS is we've got 6 fellowship-trained joint replacement surgeons. That means that I'm an orthopedic surgeon who did a 5-year residency, and I did 1 year where I just did hip and knee replacements. And there's 6 other people like that. And so the point is that one of the great things about our practice, if you want to see one of us, we can generally get you in within a week. So you come in for a consultation. We'll go over everything that you've done, what the possibilities are, both conservative and operative, and then go from there. And then if you are a candidate for joint replacement surgery, we'll go over everything in the office. We'll start the process of from getting there to the finish line of surgery. So that means seeing your primary care doctor to make sure that it's safe for you to do the surgery. It's getting authorized with your insurance. It's getting in to see the physical therapist to make sure you're ready for the recovery. And then all of us will see you back right before the operation, whether it's 4 weeks from then or whether it's 4 months, just because it's a lot of information to absorb in one visit. And the way that we all view this is a partnership, and we really want you to understand what you're getting into and what the process is like.
Yeah, absolutely. And is there any prep that the patient needs to do on their own before they come in for the replacement?
So there is a bunch of stuff you got to do, but we try to hold your hand through it. And so there's our surgery schedulers who help, and then we have nurses called nurse navigators, which their only responsibility is to, once we've signed you up for a joint replacement, to work with each individual patient, identify their individual needs, and make sure that they're ready to go. And so all of that education that the patients have to do will happen, but it's not like we're going to sort of hold your hand through the entire process.
Okay, gotcha. So, I know earlier we were talking about one benefit in coming into the one-day surgery center is that they get to return home to recover, which is obviously good for everyone. But can you talk a little bit more about the outcomes themselves? I know that there might be people listening to this that are just apprehensive about getting a joint replacement. So maybe you can speak to that.
Yes, that's a good question. And listen, any surgeon who tells you they don't have complications or stuff doesn't happen is either not doing enough surgery or they're not being truthful with you. But the hip replacement, the modern hip replacement is one of the most successful modern operations. It's just, if everything goes right, people are thrilled with it, and the statistics sort of back that up. Knee replacement, also a wonderful operation. What the study shows, that about 90-95% of the patients are really happy that they did it in terms of their outcomes. But, of course, it's surgery, and surgery has risks involved with it. It's just, for better or worse, a numbers game.
Yeah. Now, you've obviously seen lots of different patients and have done a lot of different joint replacements. As we start to close, if there's one thing that you know to be true that you would like to leave our audience with, what would that be?
Oh, gosh, that's a great question. I would just say wherever you end up, if you're considering it, you got to be comfortable with your care team. And so I think that's one place that we excel at is, like I said, I look at it as a partnership between us and the patients. And so wherever it is, whether it's me, whether it's somewhere else, whether it's one of my partners, like I said, you got to feel comfortable with them.
I think that's the perfect place to end. Thank you so much, Dr. Greenkey.
Yeah, absolutely. Thanks so much for having me.
That was Dr. Max Greenkey, an orthopedic surgeon from Syracuse Orthopedic Specialists. For more information, you can visit sjhsyr.org and you can search for orthopedics. If you found this podcast to be helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. This has been St. Joseph's Health Medcast from St. Joseph's Health. I'm Prakash Chandran. Thanks and be well.